Hi, this is Brad Kain, co-founder and CEO of Salus. I'm extraordinarily pleased to have with us today on Voices of Experience Carole Hussey, who's had an extraordinary career supporting social health and human services organizations at the state, federal, and local level. Carole, why don't you tell us a little bit about your background?
Sure. Thank you for having me. I'm really excited to be here today. I have spent the last 25 plus years working in state and local government, starting many years ago with the Commonwealth of Pennsylvania, and then going on to work for various management consulting firms prior to starting my own company 4 years ago, Evolv Strategy Group. And I'm also co founder of a new organization called HHS Connect. And so much of my work has been in health and human services and really helping to bridge that gap between people, policy, and technology. And so I get really excited about leveraging information technology and innovation to really improve outcomes for families and people in communities. And that can be intimidating for folks. And AI, which we're going to talk about today, is one of those really exciting and intimidating areas, and with lots of potential. So I'm excited to talk about that today.
Awesome, Carole. Well, let's dispense with the buzzwords, can we?
Yeah.
So, what does AI mean to you?
Well, in terms of, I do try to break it down, for folks so that AI in and of itself can mean a lot of different things, right? Technically. But for me, when I think about AI, especially in health and human services programs, we're not talking about robots replacing people. What we're really talking about are creating and providing tools that help the people do their work better. So in our world, AI means, not replacing professional judgment or replacing people, but augmenting and supporting the important work that they do. So, for example, AI can analyze thousands of case notes. That's really important because when we have caseworker turnover, for example, in child welfare, being able to quickly summarize and distill that information to a new caseworker can make a real difference in the life of the clients who they are serving. So, those are the ways I try to explain the potential that comes with AI. Most people don't need to understand all of the technical aspects of what's under the hood necessarily. But what we really want to do is focus on how do we leverage these tools to help organizations do the work and complete the mission that they strive to do every day. And that's supporting their clients, supporting their workforce, meeting their contractual and regulatory obligations, being fiscally prudent. These are all things that I think about when I think about AI and what that means to doing work in health and human services.
What strikes me, Carol, is your answer, I think, is first entirely correct. But, we've been through various waves of technology over the last 30, 40 years. Do you think it's fundamentally different?
It, well, and we joked about this when we first met, Brad. We were both around when the internet came out, right?
I, I,
and
I hesitate to have you give that away, Carol, but sure, let's go with that.
But it's funny because I was certainly around when the internet came out, and I had the great fortune of working on the beginning of my career. I worked for a very large credit card company, and I actually had the great fortune to work on the first online credit card application, and it was very exciting at the time. But I recall, right, and we discussed this, people saying, I'm not putting my banking information online. I'm not putting my social security number out there. And now you look at where we've come in the last 25 years just with that, and now we can't get by without it in a lot of cases, right? It's required for us to use it in some aspects of our life, but also I want to use it. And so I don't think it's necessarily um, much different than that, in terms of an innovation that has really disrupted how we live, how we work, all of those things in that regard. What I think is different this time, when I compare it to the internet, is that I see a more rapid acceptance of AI than what I think I observed with the internet. When and AI has been around for a long time, I should say that. This is not actually that new. Um, But when we think of AI, a lot of people think of AI, they think of Gen AI, right? ChatGPT and things like that. And, several years ago when OpenAI first, became the big buzz, there were, for a minute, there was a lot of fear and a lot of negativity, and there still is in some ways, but I do feel like there's a much more rapid acceptance of the opportunities that come with AI and a willingness to work together to figure it out. So that's where I see the difference, and I'm pretty excited about it. So, carefully excited about it. I do recognize there are challenges.
I have to agree in that I've not seen another technology that's had this burst of interest and engagement, both positive and negative. And I think we're all engaged with the idea of how it can help us be more effective professionals. But how do you think it might affect human services and human services providers in particular?
Well, there are so many people involved in human services, in the care and well-being of people, right? Many of these programs are community-based organizations. They have funders, some of them government-funded programs and otherwise. So when I think about the impact on human services, I think about all of those people, the wide array of stakeholders involved. And, first and foremost, obviously, the people who are being served. With the appropriate application of AI, we can reach more people. We can reach them differently. We can make it easier for them to access the services that they need. So that's kind of that front door model, and we see a lot of that happening all the time now, that like people are really thinking about AI agents and how can we better serve people, things like that. But then I also think about your workforce, right? How are we equipping in human services? Many of those services are delivered by nonprofit organizations or providers in community, and it's a mobile workforce in a lot of ways. And so you think about mobile technology solutions and how we support work in the field and beyond, and how we bring data together from so many different sources into one device, right? While I'm out in the car or in the community doing my work. Lots of different applications for AI there. And certainly in terms of like operational efficiency, policy and regulatory compliance, there's just so many ways in which we can have very significant and positive impacts on the way human services are delivered in order to achieve the outcomes that we're striving to achieve.
I think the big question for everyone in the sector is how can we improve outcomes using a technology like AI? And I think everything that you mentioned is correct. Better engagement of constituents, better use of the resources that stretch-thin organizations can leverage, some smart applications such as case summarization, et cetera. But how do we get from here to there?
Well, a lot of it, really is about data and, getting data into the hands of the people when and where they need it, regardless of which one of those stakeholders that I was just referencing you may be. But we also want to make sure that we're providing that data in a timely manner, that we have quality data. And so AI can help with a lot of that, but those are things that we might also have to do some cleanup with in order to leverage AI in the best way possible. But there's so many ways that we can, change how we deliver services with AI to improve outcomes. So, for example, with the use of AI and, gathering data from all of these various places, I might be able to identify, for example, a shelter that has an open bed that may not be in my town, but perhaps there's one in the town next door, so that I can get an unhoused person a bed for a night or two, right? There may be ways in which we can leverage AI to provide proactive services to prevent poor outcomes. So if I know that, there's a a single mom that maybe lost her job or is at risk of losing her home, I can help that person perhaps to get, new housing secured. Might be able to help with some childcare so that, she could go to work, things like that. So I really think the ability to leverage AI to bring a lot of disparate systems together and provide data and information to the people on the front lines has a lot of potential to prevent poor outcomes. And then also, associated with that is just, looking at what are we doing that results in positive outcomes. And so again, getting back to that data, knowing that, we don't have to follow a prescriptive checklist that is the same for every single person. The service delivery model should be delivered based upon the needs of an individual. And so if I, am the mom I just spoke with who's in crisis, maybe I need a different level of services than a parent who is struggling with substance abuse disorder or something like that. So the way we deliver services, the order in which we deliver services, the use of AI in analyzing a lot of that data quickly really has huge potential to changing outcomes for families sooner rather than later, and clients, not just families. But there's a real value in having longitudinal studies, but we can act now. We can be proactive. We don't have to wait and then analyze and then change for other populations. There are ways in which we can really accelerate how we're serving people to improve outcomes now with the application of data science and AI.
So to summarize, it sounds to me like you're saying that it is the same lessons that we've been learning about technology incrementally, over the last several decades, but it's going to be faster, more immediate changes, and maybe some better results because of where we are with artificial intelligence. Let's take the optimist hat off and put on our pessimist hat on for a moment. What do you see as risks?
Yeah. And, it's always important, any big decisions you make in life, any transformations or big changes, to evaluate and plan for risk. A project manager by trade before I got into doing many other things. But, planning for risk is the key. So identifying what are those areas where we might have risk. Starting small, not trying to boil the ocean, certainly want to think about it in that way. Measuring along the way to make sure that we're achieving the outcomes we want. All those things are things we should be doing in terms of risk management. But the specific risks that we have with AI, I talked about data. I talk about data a lot when I talk about AI. And one of the big risks and one of the reasons why a lot of people in certain areas of human services are really opposed to AI is the risk of bias. The tools, the formulas, the algorithms, all the things, they're only as good as the data that we have available to us in order to inform the important decisions that we're making, right? I talk all the time about human in the loop. We are not replacing people. We are helping them do their jobs better. But if the AI tool is recommending something based upon poor quality data or incomplete data or already biased data, the recommendations that might come out of that could be flawed. And, certainly we also have things like hallucinating, in AI and things like that. So AI systems learn from the data they have. And so it really is important before you go down the AI path to make sure that whatever the data sources are that you are using are, clean, credible, as free from bias as possible. You can certainly build AI tools to adjust for bias. And so where you might have bias, maybe your AI solution is going to either ignore those parts of the data, perhaps adjust and provide additional information to you so that you make different decisions knowing that bias could be there. But especially in health and human services, we should be very, very focused on not perpetuating, inequity. And so, or any kind of negative bias that could result in how we serve. So I often advise states and providers to really think about how you can use AI for good. We should not be using AI for punitive purposes, just in general, but also because this is an emerging solution, right? Emerging technology. And we want to make sure that if we are using it, how we apply it is going to result in the improved outcomes that we talked about. And so when I talk about a proactive scenario where a family's at risk, it's not so I can remove the child from the home. It's so I can help them get heat, or I can help them get food, those sort of things, and that cross-programmatic service delivery model. So we should be using AI to help people, not to inform, punitive or negative things. So that's another area of risk that I think, we really should be thinking about. And if you're just entering, this AI world, identifying your first projects out of the gate that are low risk, keeping that low, like be very specific about the use cases that you are trying to solve for with AI, as opposed to trying to do everything at once. Try something, measure it, see how it goes, and then maybe take to the next step or a bigger audience. But I think we have to do this in a very methodical way and lower the risk along the way wherever possible.
I think to your point, I think there's many areas that you can improve the efficiency and productivity of a caseworker or anyone with client-facing responsibilities without trying to replace their judgment. Because I think that's where you introduce this danger of bias or shifting their time and attention away, based on some faulty assumptions. And we think about that a lot, within Salus when we're looking at some of the tools that we're building with clients. I did want to ask you one other downside. It's been estimated that using generative AI to help you write a 100-word email might take as much as a half a liter of fresh water. Any thoughts or comments on that aspect of how we're embracing this technology?
Yeah, I mean, it's an fascinating and an important question, right? I mean, anytime we have a digital innovation, it comes with a cost. And quite often, at least initially, that cost is intensive and high. Over time, hopefully that will get better. With AI, it is resource intensive, and that includes water and energy use for data processing. You mentioned the water, and as an example, but context does matter. If we are using AI to reduce travel and improve efficiency and other cost savings areas, how does that compare with the costs of the resources there? So I think as with everything, the key is responsible innovation. We talk about responsible AI in a lot of ways. Usually we're talking about it, from an ethical perspective. Environment and climate are certainly ethical perspectives as well. But I think that, we have to make some deliberate choices about when to use AI and how to use AI, and especially continuing to push for greener, more efficient infrastructure to support the technology as it evolves.
Just such a breadth of interesting questions, isn't it, Carole?
Yeah.
Do you have any final thoughts for the folks listening in today about AI and about where we're going?
Yeah, I'm excited about it, and as I said earlier, and I think it's also introducing to the health and human services world a whole new array of opportunities of product companies like Salus and others who are bringing that innovation. Because it's so new, I think it really opens up the opportunity for some rethinking about how we deliver services, how we engage with our clients on the front line. And I would love to encourage organizations to really think about that, because applying these AI tools to how you do your work today isn't really maximizing your potential. And kind of, white space think about if we could design it differently today, our business processes, what might we change? Because now we have these amazing tools available to us. Are there ways in which we could modify our service delivery model, including how we engage with community stakeholders and partners, and how we report to our state and federal partners who are funding many of these engagements? And so really just encouraging modern thinking to go with modern technology and a willingness to change, because we have a big opportunity, and if we're going to maximize the potential return on that investment, we really need to be open to changing our own processes.
That's right. And as much as you and I might have liked the 80s together, Carole, let's not re-implement what was done in the 80s, just using a new technology. So
Yeah, I would say it was a great time for music, but I'm not even sure about that. So
well, thank you for joining us today, Carole. There's been a great conversation, and hope that people that have questions, comments, on today's show will reach out to you or reach out to us here at Salus. And thank you very much.
yeah, thanks for having me. It's been fun.